Barry and Kathleen lived the life they dreamed of. They had a wonderful marriage, 2 great kids, a rich social life, and traveled the world. Until Barry went for a routine physical in 2008.
A couple of days later, I got a call back, and I was told that I had IPF and that I had a very short life expectancy. It was a crash.
Idiopathic pulmonary fibrosis, otherwise known as IPF, is a progressive scarring of the lungs, restricting the patient's ability to breathe.
Living with IPF is a complete downer. It's an emotional thing. You can't deal with it. Mentally, you're thinking all the time, why me? What did I do to deserve this? I had a death sentence.
When a patient is diagnosed with IPF, it's shocking. It can change their whole lives. Because historically, most patients with IPF live for about 3.5 years after the diagnosis is made. So this is almost as bad as being told you have lung cancer. It totally changed the patient and their family's life.
Unfortunately, I have the disease, but Kathy, on the other hand, her life has changed dramatically because of the workload. Where I used to be able to do the weeding out in the garden, and I used to be able to run up and down the stairs to get the tools when I was fixing something, she has to do all of that now.
If someone starts experiencing some cough and gradually noticing that they're getting more short of breath on exertion, they should go and see the family doctors initially for an assessment. That may very well include a chest x-ray and maybe a breathing test.
Being proactive about respiratory concerns can help preserve lung function.
By the time 50% of lungs is gone, and that's when I make the diagnosis, I cannot get the 50% back.
I decided that what I needed to do was I needed to get the best medical advice and the best medical care that I could.
Patients with IPF should pay attention to their nutrition so that they maintain an ideal weight. Exercise regularly, keep the lungs stretched and working, and then manage with the help of the doctors conditions such as asthma, postnasal drip, allergies, and reflux.
In addition to making lifestyle modifications, recent therapeutic developments are also helping to improve the outlook for people diagnosed with IPF.
The big difference compared to 5 years ago when I meet an IPF patients versus today is there are 2 treatment options. There's a drug called pirfenidone and there's a drug called nintedanib. They work in different mechanism, but in independent study, they have both been shown to actually slow down the progression or stop the progression of IPF. It is always nice to have more than one option in treating any conditions. First of all, neither one of the 2 options totally cure the disease. So that means that there are still patients whereby maybe they may not benefit from one, they can benefit from the other. And it also set us up very nicely for future exploration, which is currently being discussed, about how do you then combine potentially the 2 into 1.
For the first time, both my wife and I are optimistic. I'm into my 8th year now, and it's good to feel this way. Nobody's beat it. We're still looking to the future, but here I am, way past the period that they promised, and I'm doing just fine, and I'm feeling pretty good.
Now that we have effective treatment to slow down or stop the progression of IPF, the earlier that we make the diagnosis, the earlier we institute the treatment, the better we have a chance to actually stop the patients from losing more lungs and so that they can preserve their quality of life.
The advice that I give to anybody that just got IPF would be to get over your down period, fight. Do your homework, go to the computer, find out what it's all about, and then find yourself a good doctor and get in there and fight.
Find out more at healthandfamily.ca and cpff.ca.